In the undeveloped countries like Nigeria, people walk a lot. So the fact that they're going to get obese from eating is very unlikely. So when you merge all these preventive measures with what is available, and then you have the orthodox physicians giving you advice and medication that you can use, so that somebody who is diabetic and puts into practice what they have learned from their traditional practitioner, and they get their medication from their physician, then you see that at the end of the day, the society will benefit from both arms and they will have better care.
So if you have a forum with some of the leaders in Africa, what would be one of the major things you would want to advise them on in terms of not just your profession, but on the healthcare issue for Africa itself?
You know, I just wish that everybody would see everybody as brothers, whereby there are some people who have so much money they don't even know what to do with it. Why would you take a jet, private jet, just to go and take a few of your family members in the midst of where people do not have food to eat? If people look at each other and believe that we have a common cause, then there's going to be progress. If you look at the African countries mostly, there's the haves and the have-nots. There's no in-between. If the haves and the causes, I know a lot of people will not like what I'm saying. The money belongs to everybody. It's a nation. We need to share it. The natural resources that are available are just in the hands of people who, by the virtue of the fact that they are in these places, use it to their own benefit. If they can look into their own conscience and believe that the millions of money that is in the wardrobe would benefit people if they bring it out and give it back to them as loan, invest it in such a way that the country will benefit. I'm not saying they should hand over this money to individuals, but put it in a way, in a place whereby it will be available for investments. And do not, the interest rate that they charge to get the money back is so astronomical. In India right now, there are people who are entrepreneurs. They set up small-scale industries for women and for people who are of low, who are below poverty level. There are thousands of things that they can do to generate income. They just need that capital, and instead of putting it locked up somewhere, you bring it out, it's available to people, you still generate the same interest. And therefore, you don't look at healthcare system as draining. Healthcare system where a child can grow, can eat, the brain will develop, they will give back to the nation. Set up hospitals whereby the doctors can afford to give service for free if the government pays them well. And then there's no way you will not be able to get medication. But when you import medication for 10 cents and you are trying to make money out of it and you sell it for $100, you're just killing the nation. They need to get experts who, I know a lot of my colleagues are ready to give back to the community. And I know if you offer them the opportunity whereby they can do this, many people will offer their service for free. If our government is ready to work with their people and see their people as a way of progress, if society is healthy, then I believe the nation will be wealthy. I'm working with a lot of traditional practitioners to see how we can actually help the people at the grassroots to believe and to be trained and be able to treat patients within their limitations and refer patients to the tertiary centers where they can get care. And I was looking for ways whereby we can work with the government to develop our hospitals and make it a first-class hospitals where we can maintain and get facilities and treat patients appropriately. For instance, a lot of our patients now go to India where care is cheap, but the problem with that is once they get the treatment and they go back home, there's no appropriate follow-up for the patient. So eventually they die. If we can get a system whereby the doctors who are there, I know they're doing a good job, but it's just that they are overwhelmed. And technology has not actually caught up in my country as well. So to say we can get private entrepreneurs to work with the government and to work with doctors to get things set up, I think that might be a better system for us. Government, the good thing that the Nigerian government actually did in the past was that they actually have a list of all the herbs that are useful, that can be used for medicinal purposes. And therefore, it will be very hard for somebody to actually patent each individual plant that we have, which is a natural thing. We need a lot of help from the government to set up individual, first of all, farms. We need a lot of farms to be able to grow these herbs. We also need people to believe in setting up research labs where all those things can be done. I believe in organic medicine. I believe in the power of plants. I believe in the power of fruits. I believe that you can live a healthy lifestyle by reducing the amount of artificial foods that you put into you, to acupuncture, whereby you also use your spirituality to heal yourself. I know a lot of people who have said that they beat cancer, and when you really hear what they've done, they actually increased and boost their immunity up by using various plants and use various techniques to keep their system in an optimal plane or situation, as they call it. If you are less stressed, your blood pressure will go down. Your need of using antihypertensive medication will decrease. People go into yoga, they go into exercise, they go into food management, like the type of food you are eating, less of sugar, more of veg, less of fried foods and everything else. And so when you see that, a lot of people have been able to reduce the amount of medication and even get off medication for both their diabetes, their hypertension, and cholesterol. All these are added on toxic substances that we have put into ourselves. And so if you find a way of living a healthy lifestyle, I'm sure most of the secondary diseases that we have will be eliminated.
And finally, do you see if what you're saying and some of these things are implemented, do you see a bright future for Africa?
Actually, I see a great future for Africa. I see Africa in a way whereby a child would look up at you and say, this is what I want to do, and not that I want to be a banker, I want to work with money, or they will actually look at you and say, I have a future. I can give back to my country. I go to school, and if you don't end up in university, you can do other vocation. My challenge in life is to actually build an orphanage whereby there will be avenue for children to go to school when they get to a certain level. If it's carpentry you want to do it well. If you want to be a farmer, you can do it well. If you want to go to the university and train, you can do anything that you want to do. And that's the future that I have, where everybody will see each other as brothers, and everybody will be ready to give back to their country, just like JFK said, ask not what your country will do for you, but what you can do for your country. Thank you.